Hi, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and founder of Above and Beyond Cancer. Welcome to our Cancer Education Series. A shout out to the Iowa Cancer Consortium, which has provided a grant that funds this program in part. And tonight, our guest is Pam Ganz. Welcome, Pam.
Hello.
And Pam is from Lincoln, Nebraska originally. She went to Connecticut College for her undergrad degree and then did some specialty training in child life specialist and pediatric oncology counseling at Johns Hopkins University in Baltimore, Maryland, and then came back to Nebraska where she got her master's at the University of Nebraska. Her career has included time at Phoenix at the Children's Cancer Hospital in Phoenix, and she has done a lot of work with both child life specialists, pediatric oncology, grief counseling, and counseling for children of patients who have cancer. And that's going to be our focus for this evening's discussion. So welcome, Pam.
Well, thank you. And thank you, Dr. Deming and Above and Beyond Cancer for asking me to participate. I'm really pleased to be here.
One of the great things about being virtual as well as in person is we get to have experts that aren't living here in Des Moines that can participate with this. So one of the questions I asked folks is, what was your claim to fame in high school?
I think friends are the thing that I think surprises people is that I was a junior rodeo queen.
Awesome.
Right?
Awesome. And so, yeah, did you actually compete in riding events? Or were you also an equestrian?
Yeah, I'm a horsey girl.
Good.
So,
Okay.
yeah.
Well, excellent. That's a good claim to fame. Um, so you started off your higher education at Connecticut College. What was your major at Connecticut College?
Child development.
Yeah. And maybe what was one of your more interesting experiences there in Connecticut, in New London, Connecticut?
Well, I think it really probably was the academics of it. That's what kind of sparked my road of what I pursued. It was in one of the classes I took on adolescent psychology, and it traced back to the effect of hospitalization on young children. And back in the day, parents weren't allowed to be at the hospital with their children, and it caused a lot of damage with children, not having parents there and the separation. So then I found out about the program of Child Life, which was helping children adjust to hospitalization and illness and the importance of being with children and telling them what's going on.
And that training was at Johns Hopkins, is that correct?
Correct. Mm-hmm.
Yeah, and were they one of the nation's leaders in developing child life as a specialty?
Yeah, they really were back
Mhm,
in the day, and what a great place to be because literally families come from all around the world
mhm.
to be there. And the bone marrow transplant unit was my favorite place to be. The kids were there for a very long time and needed activities to do. I needed information about what was going on. It was fascinating.
So when you think back at your time there, can you maybe share one particular experience that maybe shaped the direction of the rest of your career?
Yeah, it was a family I worked with. And when you're young, you just get really close to certain families. They were there for a long time. They were out of their cities, away from families, and it was a young boy named Danny, and he ultimately did not survive his disease, but it was very impactful for me to work with him and with his older brother and being on the unit and seeing the effects that the illness and the treatment had on families. It was really apparent to me that it took very little to improve a situation, whether it was just taking time to listen to their concerns and fears and supporting the parents, and the siblings, of course, had far different needs and concerns. They were concerned about their sibling, but also other issues of envy and jealousy of the attention that their brother or sister was getting. But it really was this wonderful young man named Danny that just inspired me to pursue a career. I knew I wanted to work with kids coping with a cancer diagnosis. And yeah.
And then you did get then a master's at the University of Nebraska. Was that before you went to Arizona to the Children's Hospital?
Mm-hmm. It was. There was a mentor here in Lincoln at one of the hospitals that had a lot of the cancer treatment. And I told him what I was wanting to do. And he said, well, you also need to learn to work with adults who have cancer. And which I did primarily throughout my master's degree. And it was really valuable, a very different set of patients than young children. But it was very impactful as well, because that introduced me to the whole part of the family experience of parents having children and the needs of those children as they tried to navigate the journey with their parents.
How would you say cancer care for either adults or children has changed in the way we deliver care? Not necessarily, the drug we use or the surgeries or the radiation, but the manner in which we provide all of this wraparound services and support services. What changes have you seen over the past 20, 30 years?
Well, I think that's been the beautiful thing. And when I started my career, we moved to Phoenix, my husband and I assumed that there were probably psychosocial programs in place at the Children's Hospital, and there were not. And the pediatric oncologists were wonderful. And they said, well, why don't you try to implement some things? And if they work, then we'll hire you. And so I volunteered my time because I was absolutely certain that they would work. And they did. And it was just a wonderful job. And we started a camp for children dealing with cancer, and that has grown. Everything just grew exponentially. And I think that's what's changed, is that there wasn't so much a focus on the psychosocial issues. And now it's such a big part of programs. And
Mhm.
I love that, whether it's pediatric or adult, it's recognizing that it's not just about the physical treatment, that of course that's the primary concern right at the beginning, of course, but that diagnosis changes everything. And
Mhm.
so you want to have programs that support those changes, whether it's nutrition or whether it's kids trying to go back to the schoolroom and what that looks like for them, and children who have parents with cancer, having support for them because their reality is different than their peers at school. So I just think all the programs that cancer centers have initiated, and they're growing, it's just a fabulous thing.
Yes, yes. I like to say, that taking care of a cancer patient is a human being taking care of a human being, and the human aspect of it. I mean, you mentioned when you talked about your first experiences with the children that you can, within 10, 15 minutes of being present and authentically there, have such a positive impact that is so much greater than a pill or another treatment. The act of being present in the room as a human with another human, listening and caring, can have such positive effect.
Oh, I agree. And I think, just like what you said, it's that listening. I think sometimes we don't put enough emphasis on the power of listening, because it for someone to feel like they're heard, means the world to them.
So tonight we're going to touch on how to help children whose parents have cancer. That's kind of the focus of tonight's talk. And I know that you prepared a few slides. Maybe we can go to those to sort of kick off the conversation, and then we'll continue a conversation back and forth, and we'll use the slides as kind of just the bones or the framework for our conversation tonight.
Okay. So what's kind of behind this, and what I really like to stress to parents, because I know that parents worry about what the short and long-term effects of a cancer diagnosis might have on a child, but I like to always begin everything by saying that along with the seriousness of a situation is that kids are very resilient little beings, and resilience is one of the positives that can come from a negative. And that even though that cancer diagnosis will impact a family and parents' concerns are real, there's just a lot of room for optimism when it comes to kids. Resilience is just one of those phenomenons that can only be considered within the context of adversity. But because this is a phenomenon that happens, I have pages in both books that address that. And this is a page from my workbook for children about 12 years and younger that helps them identify the things that they don't like so much about the changes cancer has brought into their life, but that not all changes are bad. And it's really interesting to see always how kids fill this out and what those positives are.
Yeah, no, that's such a great point. Everybody's heard of post-traumatic stress, where going through a difficult time, you come out without being able to cope with normal things. But probably a more common experience is post-traumatic growth. Where going through a difficult time, you actually find the strength you have within yourself. You know, it didn't give you the strength, but the adversity allowed you to find that strength, and growth comes out of
Mhm.
that, and the recognition of your own strength is what resilience is. A little bit like COVID, where we have come through this, but we found some silver linings. And we talked about the idea of telehealth coming out of, and virtual meetings, and being able to have this conversation with you while I'm here in Des Moines and you're in Lincoln. So some good things do come out of adversity.
Mhm. Right. And with kids that it doesn't, just happen. That resilience you can build it and really strengthen it. And one of the things that does that is having that supportive adult child relationship. And in the context, it's important that kids have a parent's trust and support. And that includes, as we talked about, listening to the kids and trying to understand them and validating their feelings and answering questions.
Right.
Yeah.
Listening and answering question. I'm sure you're going to get into the, different ages and what's age appropriate or emotionally appropriate depending on the particular child.
Yeah, there's a vast difference between a 6-year-old and a 16-year-old. The needs are, quite different. So what a parent, how much or how little you share, it does depend not only on the age of the child, but then just the individual personalities. Sometimes you have a really nosy kid, and sometimes a child, it's just need to know. This is a page, again, talking about the resilience. This is from the book for teens, and these are all things that teens have told me in support groups about what they felt were positives that came out of negatives.
And would you say that these have all come out of interviews that you've done with teens whose parents were facing cancer? Wow.
Absolutely.
Yeah.
Yeah. Yeah, these are all positives that have come out of an experience of dealing with cancer. And again, resilience doesn't just happen. It requires that supportive adult relationship. And it also requires that kids learn coping skills that they learn how to cope with these emotions that they're feeling in healthy ways, and learning even just how to name an emotion and how to deal with it. And you want kids to be able to say, I have ways to express what I'm going through, and I can learn healthy ways to handle those emotions.
So with the teenagers, um, how do you get brought into the picture? So as a professional child life specialist, oncology counselor, maybe paint the picture for the first time you might meet a teenager who's has a parent that is on the cancer journey. How do you get brought into the team?
Well, it would be someone asking for help with their teen, and how to talk with the teen about the illness and the diagnosis and what they're facing. A lot of times teenagers especially have the tendency to want to protect their parents, and I think that's something kind of unique to that age group, so that sometimes it's interpreted that they're very indifferent or they don't care what's going on, when in fact they do. But teens don't want to be a burden, and they are very aware of the stress going on in the household, and sometimes they're not as open about wanting to share because they feel like they will just add to the stress and be a burden. So they tend to want to protect parents. It doesn't mean they don't care. It just means they won't talk to their parents about it. But it is important that they have someone to talk to, and that someone can be an aunt, an uncle, a professional. It could be the parent of a friend. But just because they're not talking to the parent doesn't mean that they're not concerned. It's just kind of the nature of that age.
Mhm. You know, and you sometimes see that even with adults where let's say a friend is going through something and you're afraid you're going to say the wrong thing. And so you kind of back away and don't say anything. You know, if it's a really close friend, that might not be the case, but with this fear that you're going to make the situation worse by saying the wrong thing, I'm kind of hearing a little bit of a resonance of that, maybe with the teenagers.
Yeah, they don't want to upset their parents, and they might be very concerned about um, the parent losing their hair, or something that I think people kind of tiptoe around it, but kids really of all age, parent going to die, and that's something that people tiptoe around, don't want to ask, but it is on people's minds. And I do encourage parents to be prepared for that question and have an answer, because it usually will come up. And if it doesn't come up, a parent can offer that out and say, sometimes kids are concerned that their parent will die. Even if your child isn't asking it, once you say it, they know, then it's a topic that's okay to talk about.
Mm.
And it's better to be out there, because when you don't give kids accurate information, they fill in the blanks with their own imagination. And that's usually never a good thing.
Yeah.
So many times in support groups with kids, they would say, I knew something was wrong at home. My parents were talking in hushed conversations. I could tell my mom was crying, but nobody was saying anything. And they were relieved to hear that the problem was their mom had cancer, because in their mind, they thought it was something far worse, which
Mm.
may not seem far worse to us. But if you're 16 years old, and you think your family's going to move to another state, to them, that might be worse than hearing that your
Mm.
mom has cancer. But kids are very perceptive, and they're little detectives, and they do figure out what's going on.
You're right, and probably at a fairly young age, the kids know something's not right, even if they're not even able to verbalize it. it always amazes me when I have patients who, and they just, well, we're not going to talk to the kids about it, and it's like, well, let's think that through, and we have some professionals that can help with this, because it's hard to imagine that you can live in a household where someone's going through this sort of a thing with thinking the kids are oblivious to anything. And as you pointed out, um, sometimes they're thinking it's going to be worse than what the real problem is. When you describe let's go back to teenagers for a second. Would you typically interact with both the parents and the teenagers separately? Would you be called in mostly to help the parents, or do you see the parents and the teenagers together? Or what are the various ways in which you help families where the parent has cancer and their children are teenagers?
Well, it'd be talking to the teenagers themselves to see where they're at with things. What do they know? What do they want to know? I think that's always the important thing to start with kids of any ages, really, is what do they already know? Because that gives you a chance to know if what they know is correct, because there's many myths and misconceptions. So I like to always start out by asking, what do you already know about what is happening? What do you know about, can they even name the disease? What type of cancer? Um, and then what do they want to know? And that's kind of the key, because I think as adults, we can't presume that every child wants to know everything. Some do, some really don't. They want to know more about how's this going to affect my life, because kids are kind of little self-centered beings. Nothing wrong with that. That's just who they are. That's that stage of life. And and once there's a sense of where the kids are at, then it's easier to talk to the parents to let them know what their child knows, what they want to know, and how can you help start that conversation, and how can you keep them in the loop. And sometimes I had a parent who was very frustrated because they wanted their child to know more, but the child didn't seem interested. And that's when it's hard. You have to just kind of back off and let them come in their own time to ask questions. And it's still okay to every now and then, as a parent, to say, we're just doing a check-in. And you can put it out there of the status of what's happening. And the child is taking it in. They may not seem interested at the time or ask questions, but you're letting them know that they matter enough that you're wanting to keep them in the loop, and you're just checking in and giving them an update. Yeah. So you need to talk to both, but I would say it's talking to the child first that's most important, to see where they're at. Because sometimes I think parents, it's easy to assume you know what they need or want to hear or those things, but sometimes we are just way off in our assessments.
Yeah. So Pam, as you're describing this, my mind is going back to 51 years ago. My mom was diagnosed with incurable lung cancer when I was 16,
Mm.
junior in high school. She did well for quite a few years. She died when I was in my second year of medical school. But I think back at, the way I responded, that was in the late 1960s, and cancer care was very different. And, there was a stigma to having cancer. We hadn't gone through the Live Strong era of empowering and destigmatizing. So there was that whole stigma. And then there was, a much different time of not talking about emotions and feelings. And even I'm trying to think back about my curiosity of the physiology and biology and, the science of the treatment versus, and what did you what conversations were you having with your mom versus what conversations were you having with your dad, and the secrecy that surrounded it. So I hadn't thought about that for quite some time until your description kind of um, inspired me to think back and what I can
Mhm.
remember.
Well, right, and that's spot on, and I had someone after a talk I gave at a cancer center in Florida and came up afterwards in tears, and it was something that had happened many years ago, and she said, "I wish that my parents would have known this back then, and I wish that they would have talked to me and been open with me," because it was a different time and they weren't, but as an adult, it had stayed with her that she wasn't allowed in on this most important time in their lives to know the truth and be present in whatever that reality was.
Hmm.
Yeah, it was, yeah.
When you're helping families, and let's stay with the scenario of a teenager, um, I would imagine that there's that it is different with the parent that has the cancer versus the parent that's the caregiver, and I can imagine that the caregiver might be a bit more protective, both of the spouse that has cancer and of the children. And do you want to comment at all about are there any particular things that you've seen in the difference between the relationship of the parent that has cancer versus the parent that's the caregiver and their interaction with their children?
Well, I think it just varies family to family. It really is very different. And of course, we have a lot of single parent
Hmm.
um, households. I'd say one trap to try to avoid with teens, sometimes teens will try to assume the role of a parent and kind of move into that role. They feel like they need to do that. And in some homes, I think that would be welcome to the caregiver parent because they're already kind of overwhelmed or could be if their spouse is quite ill. But I think when possible, it is best to allow kids, whether they're 8 or 18, to still be that 8 or 18-year-old that they are, because developmentally, that is where they need to be. It's okay to increase expectations, and I would say sometimes that might be where the parent who has cancer might have more expectations on their kids because they suddenly maybe aren't doing some of the things around the house that they were doing and need others to pick up the slack. And again, that's totally fine to increase those expectations to a degree. But again, being mindful that that 18-year-old is trying to learn to be independent. Their world revolves around their activities and their peers and school, so that trying to avoid that trap of them becoming an instant adult or even in the role of almost a parent. And the other thing I would say is not to lessen the rules at home. I think that gives normalcy to children when there's still those the same discipline and rules. That tells them that life isn't so chaotic or out of control because kids do need those boundaries still, and that's comforting. I know that doesn't always
Mhm.
sound like it would be, and kids, of course, think, "I don't want any rules." But in reality, then life feels very chaotic to them and scary because then they interpret that as things really must be bad with my parent because now they don't even care what I'm doing. I can do whatever I want.
Mhm.
So,
Pam, you provided us with a video of a young man. I think he was 16, perhaps, when his father was diagnosed with cancer. Perhaps this would be a good time to play that video, and then we can.
Sure, sure. If it's David, I think if it is David, his dad was diagnosed when he was young, but
Oh, he was young. Okay, sorry, not a teenager. Okay, why don't we play that, and then we'll use that as a springboard for conversation about the wisdom he's sharing with us, and then maybe we can transition from talking about teenagers to talking about younger kids whose parents are going through the cancer experience.
sounds.
My name's David. I'm 24 years old, and my father was diagnosed with neuroblastoma, brain cancer, when I was 6 months old. So if I have any advice to parents who are going through cancer treatment and trying to figure out how to include their children, it would be, one, to gauge the level of inquisitiveness that their kid has. If their kid is asking tons of questions, if they seem like they want to be part of it, if they are expressing a desire to understand whatever limited vocabulary or understanding of mortality and disease they have. But if that want is there, to find a way to foster it. It's never going to be perfect because kids can't understand often, the intricacies and complexities of a disease. Even adults struggle with that in dramatic ways. But if that desire is there, I think it should be fed. And for me, it was one of the most empowering and comforting things for me to ask a question and to feel like I was getting a real answer, both from my mom and dad, to not feel like I was being condescended to not feel like they were trying to make the situation seem like it was better than it was. He and my mother did a great job at saying, this is rare, this does happen, but it's not going to necessarily happen to you. I would say things like, this is what is happening to daddy. It's not what's happening to everybody else. You don't need to be afraid that this is going to be your life too. And this does not mean that you are him. And that was also very important. So I used the workbook, which is called Life Isn't Always a Day at the Beach. And my main memory of it is that it created a visual component for what I was going through. The workbook was huge for that. And my mom and dad sent for a huge number of resources. And this was one that we did together and that I remember was incredibly important in developing some of the language that we used, in thinking about how to talk about the disease, and that I believe they had actually done together before they shared with me, and they got several copies of it. So they had their own idea of what it could offer. So I remember that they already were very literate in what I was reading and what I was doing, and that it didn't feel like they were just giving me something to make me feel better. It felt like we were all doing it together and that they were guiding me through it. So I guess that's a piece of advice too, is that if you're using a workbook, if you're using a resource, to make it a team activity and a family activity. It was something that we were confronting together, and that they were going to both listen to what I wrote in the workbook and how I contextualized my feelings and my understanding of my father's disease, but that they were doing the same work too, and that it was work that we were all endeavored in as a team, as a family, and as three people, in my case, who were going through something that was united.
So Pam, he referenced the book that you wrote, Life Isn't Always a Day at the Beach. And you're right, I think he said he was 6 when his father was diagnosed. And is that sort of the age group for that particular book?
Yes, that up to about age 12. Mm-hmm.
Okay.
Yeah.
And maybe describe a little bit your impetus for writing the book, how you actually came up with the design and the the particular activities, and share with us how, besides David's testimonial to how it helped him, how you've seen it help families coping with cancer diagnosis.
Well, the American Cancer Society was doing a family workshop. This was, goodness, probably 1995. And I was asked to facilitate one of the groups. And with kids, you really want something that's interactive, just because they don't have the language skills. They're not going to just tell you and have a conversation with you about how they feel and how they are coping with a situation. So I created probably about 10 pages to use at this day-long workshop, and the kids loved it. And so then a friend that I know is an artist, she did the illustrations, and it turned into a book that was published, and that was 1996. And it's been used all over the world, I can say, and even translated into Hebrew and used in Israel and also Arabic. And I think why it's used is that it's very simple. It's a tool for communication to open up conversations between kids and parents. And like David said, it was something they could do together. And it's something that within a family unit, because everybody deals with cancer in a different way, it also increases empathy and understanding for one another within a family unit, so that everyone can be respectful that the way I'm coping with it might be different than my brother, but that's okay. One way isn't right or wrong. We're just different in that way. And I think that having that tool that allows kids to express their journey is very important. It's very validating. It gives parents insight into their kids and lets them know areas where maybe they need to explain a bit more about the situation, or maybe that their child is more worried than they thought they were. So let's think of some strategies to alleviate some of those fears or alleviate some of the stress. Yeah.
And when did you first have a relationship with David? Were you involved with his parents' care, or his dealing with it when in real time back when he was younger?
He is someone that his parents reached out to me at the time of diagnosis, and knew that I was working in that area, and knew that I had written the workbook. So in that way, I was able to reach out and talk to them about what was happening in their world with the illness, and with David, how you start again these difficult conversations, and getting over that hurdle of not really wanting to tell your kids, but then also understanding that if you don't tell your children, it really undermines their trust in you, and it's hard to regain that trust. And also, if you don't talk about it, if you're not communicating, you really are communicating something. You're communicating that the illness is too scary to talk about, or that you don't think that they can handle it, or you don't think that you can get through this together. And those are really important things for kids to understand, that yes, it's a difficult time, but we'll figure this out together. We'll get through this together, and whatever happens. In David's case, his father did not survive his disease. But I would have to say, seeing David now as a young adult and having gone through that whole process, he's just an amazing human being. And I think because there were those conversations when he was young, open and honest conversation, that continued throughout the course of the illness and and during the time of losing his father, that I think just has some healthy coping skills that have helped him as a young adult and will continue to help him.
Hmm. As you point out, the resiliency. I mean, you can go through some very substantial trauma, but with the support, you come out of those times of adversity, and it doesn't always negatively affect you for the rest of your life. Sometimes provide you a source of strength and understanding of your own strength in going through difficulty.
Yeah, exactly. I think sometimes as parents, we want to protect our kids, but I think, again, what you're giving them, if you give them the right skills and building blocks, you're giving them the ability to handle life's challenges. And we all know that they'll be thrown many curveballs throughout their lifetime. So really what we end up giving them is the gift of having skills to deal with those things and handle them in a healthy way and learn how to talk about fears and concerns and ask for help.
So, Pam, maybe, and this might not be a fair question, so you can answer a different question, but I'm kind of thinking, let's say a family, and they've got a 2-year-old, or a family that has, a 6-year-old or a 10-year-old. Are there any sort of maybe universal words of wisdom that might relate to that toddler versus the early grade school versus, a tweener, or those just entering adolescence? Maybe some words of wisdom that those in the room that might have a 2-year-old or a 6-year-old or a 10-year-old that might take to heart, realizing every situation is different, and
Mhm.
maybe both from the child's perspective, but then the parent's perspective. I don't know if that's too big of a question, but
Well, I think with young kids, because they don't have the language skills, you'll see changes in behavior. And I think those are things to look out for with the young kids, any change of behavior, because they still can pick up on the subtle cues in the house. So that might be increased crying or trouble sleeping. So you want to watch for those things. Remembering that with young children, play is very important. And I would encourage the medical sets. They can be the doctor or the nurse or whatever they want to be with you. I think watching them play with their dolls and hearing those conversations. But play is really how young children work through things. And young children also have magical thinking. They think that people are indestructible, so it's hard for them to understand really how illness really works. So those very young children, their actions and feelings don't match. They might say, "I'm really sad, mommy doesn't feel well," but then the next minute they're jumping up and down on the bed while you're trying to rest. And it's not that they're trying to be a little brat. That's just who they are. They just don't understand. I think with early elementary, I'd say, you wanna keep explanations simple. I think sometimes, one of the biggest mistakes we can make is oversharing. Again, you wanna ask, what do they want to know? Um, because there's no need to tell them more information than what they're asking. They generally won't remember all of that anyway. So you keep those explanations tailored to what they are actually asking. And you want to check in frequently because those will change. And because children are growing and their cognitive skills are changing, what you tell them one time in 6 months, they might want a different explanation. Even though you have told them, they will ask again at that different developmental stage. Um, One thing also with early elementary, oftentimes they feel like they're to blame, and that guilt piece starts to enter in. And again, think about sometimes with kids when they get angry at a parent, the things that they're like, I'm so mad. I just hate my dad. He's so mean. And then what happens if that dad now is diagnosed with a serious illness? Kids feel like they had some power over that. So it's very important for parents to always reassure their kids nothing they did or said or thought caused the illness. And I really can't stress that enough. And even teens, I think that's an important message for them too, that somehow they didn't increase the stress of their parent that has caused this diagnosis.
Right. Well, good words of wisdom there. I think we're going to open it up to questions now. We've got about 10 minutes left, and we've got quite a few people in the room. And I know for a fact that folks had in the room here have had children that have lived their cancer journey with them. Poon, do you have a question?
Yes, I have two questions. First one is, how is your support group set up? Is it with the parents and children, or the children are by themselves? Or that's the first question.
The ones that I have been involved with, the children are separate, and not just separate, but then divided by age, because teenagers kind of have their own issues. It's that time of life where they're trying hard to be independent, but they're also kind of dependent as well. And then if you add in a child with whose parent has cancer, they're starting to make life decisions based on that. Do I go away to college, or should I stay local because I don't feel right about leaving? So ideally 3 different age groups for the kids. But if that's not possible, I'd say, for sure 2. And then the parent group separate.
Another question, Poon?
Yes. So does your book cover when it gets to the point of hospice care if parent is not going to make it?
Yeah, that's a good question. So how does the interaction change when it becomes clear that the parent with cancer is going to die?
Well, and that's a great question. And my book doesn't explicitly cover that. It's more of a journal workbook. There is a page in there about death and dying, encouraging that conversation. But I think, again, it's about being open and that checking in, keeping them in the loop of things aren't going as we hoped they would go. And this is where we're at now. What questions do you have about that? And I would say that within a hospice, using their social worker or their grief specialist, being proactive about that. And that's one of the wonderful things about hospice, is that they provide that grief support a year after a death. So tapping into those resources are very good, because anticipatory grief is something that kids can work on. No one's ever going to be prepared for the actual death, but kids will have some coping skills.
You use the phrase anticipatory grief, and sometimes there can be a confusion between anticipatory grief and depression, and obviously they can be linked, but the recognition that a child may be really grieving distinct from depression, and especially with the philosophical aspect of confronting death being as much a philosophical issue as a brain chemistry issue. You want to comment any further about that whole concept of how do we help individuals, children or adults, whether it's the caregiver, surviving caregiver, deal appropriately with anticipatory grief?
Well, I think that's just, it's preparing, and like you said, it can look like depression, but I think it's a conversation of it's okay to be sad. Um, it's a hard time, but it allows conversation and honest time together, because if a child knows what is the likely outcome, it allows the parent and child to have time together. And David, he doesn't talk about it in that video, but he and his father made a point of, they wanted to have a memory together of all the favorite things that the dad enjoyed doing. And so that was something they decided together. And so David, as this young adult now, has these great memories. He got to go to a rock concert of the band his dad loved. He got to go fishing. And so I think that anticipatory grief, it's about loss. And of course, there's little losses all along the way. And that's what grief looks like. And it's okay to be sad about those changes, those little losses in little incremental ways. But it's also okay to have those conversations, because it allows for the parent and child to devise something special and meaningful that means something to both of them, and the legacy of what a parent wants to leave, and for the child, this beautiful memory that they carry with them forever.
Yes. I think we have another question from the audience here.
Yeah, I had a question about magical thinking. I always thought that's just a coping mechanism because you can't deal with reality. But at what age do we expect not to see magical thinking?
That really, certainly by late elementary, you wouldn't see magical thinking really then so much. You really see that mostly in preschool. Definitely preschool, but also a little bit in that early elementary, where they don't understand fully that thoughts don't make things happen. By the time you're in late elementary, developmentally, most kids do understand they don't have that power.
Any other questions for Pam? And Chris, do we have any questions that have come through on the... Okay. Well, Pam, I have really enjoyed this conversation. And before we bring it to a close, I apologize, we didn't really go through your slides. Is there any aspect of the subject of children of cancer patients that we haven't touched on that you would like to share with us before we close it tonight?
Well, maybe there's the very last slide. If you just are able to throw up the very last one, those would just be some of the little tidbits, I think, to leave everyone with.
Okay, we will bring up that final slide. Here we go.
And just some things to remember, just some things that kids need. And this is true of all ages. And that's what I think I would probably like to leave everybody with tonight.
Great. So I'll go ahead and read these. Accurate information about the illness presented in concrete language the child can understand. Assurance that nothing they said, did, or wished caused the cancer or can make it better or worse. An understanding of the prognosis. Permission to ask questions and to express feelings. Permission to continue to be a child or a teenager, and validation of their feelings. Yes. So great tips for all of us. So again, Pam, thank you so much for being part of our conversation this evening. I've really enjoyed it.
Well, thank you so much. Thank you. I've enjoyed it as well. It's too short. It went by very quickly.
It did, didn't it? And thank you, everyone who joined us. For those who know someone who might benefit from this conversation, it will be available on demand tomorrow at the Above and Beyond Cancer YouTube channel. And it will also be available at the Mercy One Cancer Center website. Thanks again for joining us. We hope to see you again next week. Bye-bye.